May is Mental Health Awareness Month. It's actually been observed for more than 70 years to reduce the stigma, educate, provide support for mental health conditions. And joining us right now is Sarah Prager with All Health Network. We're thankful to have you here. This is an important topic to discuss.
Absolutely.
As we were kind of saying during the commercial break, a bit of a timely discussion as well. Oftentimes we hear, should I seek help myself? Should I just push through it? But there can be dangers in telling somebody, hey, you'll get over it, you'll push through it, right?
Yeah, absolutely. We would love for people to think about mental health just like physical health. So if you have a broken bone, you have a really severe sickness, we would never tell someone, get back in the game, push through it, don't talk about it, right? So we really want to treat it the same way. Seek an opinion, seek help, follow the plan to address it, and ultimately feel better.
Sure. What are some of the myths, perhaps, that people might be getting?
I really want to highlight one or two if possible. One is, there's a wait. Everywhere you go, the lines are long, so don't bother calling. And I hate that myth because that's absolutely not true. Yeah. At All Health Network, we really pride ourselves on having access 1 to 2 days. For years, we've maintained this front door access. It's one of our key missions.
Sure.
And I really want people to know that at All Health Network or lots of other places in the community, access is there for you. And the second one I really don't like hearing is that you have to wait till you hit rock bottom to get help.
Sure.
At any stage, reach out if you realize your condition is a little bit bothersome. You have a little bit of symptoms with your mental health. We would love it for people to call then and not have to wait until it gets really bad.
Sure, absolutely. We hear a lot too about social media and the impacts that has on our health, a wide-ranging impacts that social media has. One thing I think is great is there seems to be a lot more discussion about mental health on social media, but we also know that there are some negative impacts. So is it for better or for worse here, right?
As you would imagine, it's both.
Sure.
I think it's great for people to find hope, find content creators that really inspire them to get on a wellness journey, and know that they're not alone. So of course that's a positive thing. On the other hand, we know there's some scary content out there it promotes self-harm, disordered eating, things like that. And social media in itself is designed to promote this addictive behavior of coming back to it. So where possible, I'm an advocate of limiting social media use.
Yeah, no, I think so too, for sure. So for somebody who might be seeking help instead of just fighting their own mental health struggles by themselves, what should they do to get that support?
Absolutely talk to someone. Maybe that's someone with lived experience in the community. Maybe that's a self-help group. Maybe that's All Health Network, and you call our main number or our website. But listen to those symptoms or those thoughts that you're having. I'm not really proud of how much I drank last weekend. I don't love how much I bet on the game last night. I'm more sad than I used to be. Or my friends and family are telling me, are you okay? You seem anxious. Listen to those indicators and reach out when you start noticing them. Don't wait until things get really, really bad. Of course, we'll be there for you if it is.
Right.
But I would encourage people to listen to those first signals.
Absolutely. Well, Sarah, thank you so much for your advice and continuing this conversation, important conversation. If you need help with seeking mental health services, you can always reach out to the All Health Network. Plus, you can watch all of our health interviews right now on our website, cbscolorado.com.